Hello, my dear friends, and welcome back. I'm Dr. Rose Khavari. Thank you for choosing to spend a little part of your day with me. In over 15 years of working with older adults, I've realized something: the most important conversations often begin as a whisper. It usually happens at the end of an appointment, almost as an afterthought as they're gathering their things to stand up. Not long ago, a patient, a wonderful woman in her mid-70s, we'll call Eleanor, did just that. She has been a widow for several years. We had finished talking about her bone health and her blood pressure, and as she was preparing to leave, she paused at the door, turned back, and said with a slightly embarrassed smile, "Dr. Rose, I have a somewhat silly question. Silly for my age, perhaps." I invited her to sit back down and told her that there are no silly questions in this office. She took a deep breath and said, "Well, I've been thinking about maybe dating again, just for dinner, for companionship. But I've noticed I still have feelings, desires for closeness, for intimacy. I feel almost guilty about it." Is it normal for a 75-year-old woman to still be thinking about those things? Eleanor's question, spoken with such hesitant courage, touches upon one of the most closely guarded secrets, one of the greatest silences in the world of senior healthcare. And my answer to her was an emphatic, heartfelt yes. "Eleanor," I told her, "it's not just normal, it's wonderfully healthy." Our conversation today is inspired by Eleanor and the millions of people just like her. We're going to talk about why so many older adults hide their emotional and sexual needs, and more importantly, the very real health and emotional risks of doing so. My goal today is to open a door that has been closed for too long, to tell you that your feelings are valid, to explore the reasons behind this silence, and to show you that acknowledging and addressing these needs isn't just about having a better romantic life. It's an essential part of living a healthier, happier, and more complete life. So why does this fundamental, natural, and beautiful part of being human, the desire for intimacy and connection, become such a taboo topic as we get older? Why did a wonderful, intelligent woman like Eleanor feel that her completely normal question was silly? The issue, I assure you, isn't with Eleanor. It's with the powerful, often invisible messages society has been sending us our entire lives. I want you to think of it like a room in the house of your life. When you were younger, that room, the room of intimacy and sexuality, was likely a central, well-lit part of the home. The door was open. It was acknowledged. But as the years go by, society, culture, and even our own inner voices begin to gently, almost imperceptibly, push that door closed until one day we find it locked. Let's talk about the keys that turned that lock. The first reason, and it's a powerful one, is pervasive societal stereotypes. Take a moment and think about how older adults are often portrayed on television and in movies. They are frequently cast as the venerable, wise, and completely asexual grandparent, concerned only with gardening, baking pies, or dispensing folksy wisdom. Rarely, if ever, are they shown as complex, passionate human beings with active romantic desires and needs. When older sexuality is shown, it's often played for laughs, the dirty old man, or the cougar trope, which reinforces the uncomfortable idea that sexuality and old age are two things that are awkward and don't belong together. We absorb these thousands of subtle and not-so-subtle messages over decades, and slowly, without even realizing it, we start to believe them. The second reason is our generational upbringing. Many of you listening to my voice right now grew up in an era where sex and sexuality were simply not topics for open, polite discussion. It was an intensely private matter reserved for the marital bedroom, and certainly not something to be discussed with friends over coffee, let alone with a doctor in a clinical setting. This wasn't a malicious silence, it was just the cultural norm. But the habit of silence can be a very, very hard habit to break, even when we are older and wiser and genuinely need help or guidance. The third reason is something we do to ourselves called internalized ageism. This one is subtle, but it is so powerful. When we hear over and over again that older people are not and should not be sexual, we begin to police ourselves. We might feel a natural spark of desire, a longing for touch, and our inner critic immediately squashes it, telling us, "Oh, you shouldn't be feeling this. You're too old for this now." Act your age. We become the unwitting jailers of our own most natural human emotions. This was exactly what Eleanor was doing when she called her own valid feelings silly. The fourth reason is the reality of physical changes and the profound fear of judgment. Our bodies change. That is an undeniable truth of life. These changes can make us feel vulnerable and deeply self-conscious. The fear of not being able to perform as we did in our youth can lead to a performance anxiety so great that it feels safer to avoid intimacy altogether. For women, the hormonal shifts of menopause can make intimacy physically uncomfortable or even painful, and the deep-seated shame that can accompany admitting that is a huge, heartbreaking barrier to seeking simple, effective treatments. For men, a change in erectile function can feel like a devastating blow to their identity, making it feel impossible to even broach the subject. And finally, for so many, there's the complex interplay of grief and loyalty. Like my patient Eleanor, if you've lost a partner of many decades, the return of romantic or sexual feelings can be accompanied by a profound and confusing sense of guilt. The question, "Am I betraying the memory of my late spouse by feeling this way?" is one that I have heard many, many times. It's a heavy weight to carry alone. All of these reasons combine to create an immense pressure to keep that room locked and silent. But that silence, my friends, comes at a very, very high price. Hiding your sexual needs and concerns has real, tangible risks to your physical and mental health. When you don't feel safe enough to talk to your doctor, you are inadvertently hiding crucial clues that could protect your well-being. Let's first talk about the physical health risks, because they are significant. 1. Missing critical diagnoses. This is the single biggest and most dangerous risk. Changes in your sexual function are very often the canary in the coal mine for other, more serious underlying health problems. For men, new-onset erectile dysfunction can be an early sign of heart disease, diabetes, or circulatory problems. If you're too embarrassed to mention it, your doctor loses one of the most powerful early diagnostic tools they have. For women, a sudden and persistent drop in libido can be a classic symptom of an underactive thyroid anemia or hormonal imbalances. Pain during intercourse is never normal. It can be a sign of a very common and treatable condition called postmenopausal genitourinary syndrome, or other gynecological issues that need attention. When you are silent, you are unwittingly allowing these potential conditions to go undetected. 2. The overlooked risk of sexually transmitted infections, STIs. This is a topic many older adults incorrectly believe they don't have to worry about. But the data tells us a very different story. The rates of STIs in people over the age of 60 have been rising significantly. Why? Because if you are too shy to admit you are sexually active, you are almost certainly even more hesitant to have a frank conversation about safe sex practices. An open conversation about sexual health isn't just about improving pleasure, it's about fundamental safety and self-respect. 3. Living with unnecessary pain and discomfort. This is particularly true for my female patients. After menopause, the natural drop in estrogen can lead to changes in the vaginal tissues that can make intimacy uncomfortable or painful. So many women suffer through this in complete silence, thinking they must endure it. It is not. There are numerous safe and highly effective treatments. Silence in this case directly equals unnecessary treatable suffering. Now let's turn to the mental and emotional health risks. 1. Profound loneliness and isolation. We human beings are wired for connection. Physical touch, closeness, affection, and intimacy are fundamental human needs. When we deny or ignore this essential part of ourselves, it can lead to a deep and aching sense of loneliness, even when you're surrounded by loving family and friends. 2. The onset of depression and anxiety. Suppressing a major part of your identity takes a tremendous amount of energy. It can lead to feelings of loss, chronic sadness, or even clinical depression. The constant quiet worrying about the changes in your body or your relationship can become a heavy, persistent burden. 3. Corrosive relationship strain. For those of you in a partnership, this silence can be toxic. It creates a vacuum that is quickly filled with fear and misunderstanding. One partner may withdraw out of shame, and the other may interpret that withdrawal as a personal rejection. It creates a painful gulf filled with unspoken assumptions and hurt feelings, eroding the very foundation of trust and closeness. The price of silence is steep, affecting your body, your mind, and your heart. But the good news is, it's a price you do not have to pay. So how do we find the key to unlock that door safely and gently? How do we begin to have the conversations we've been taught our whole lives to avoid? It starts with one small, quiet, courageous step. Step 1, giving yourself permission to feel. This is the internal work, and it is the most important step of all. I want you to take a moment, perhaps even later today, and say these words to yourself either out loud or in your heart. My need for closeness, for affection, for touch, and for intimacy is valid. It is a healthy and normal part of who I am, no matter what my age is. Acknowledge your feelings without judgment. You are not silly. You are human. This internal shift in perspective is the foundation. Step 2, the doctor conversation, your health ally. This is often the step that feels the most intimidating, but I promise you it is also the most empowering. Remember, your doctor is a trained scientific professional. They have heard it all. They are there to be your ally, not your judge. Here are a few different ways you can gently open the door. The wellness approach. You can say, "Doctor, as part of my overall wellness, I'd like to talk for a minute about my sexual health. I've noticed some changes and I just want to make sure everything is okay." The symptom-based approach. I've been feeling a lot less energy and desire lately. Could that be related to any of my medications or my general health? The direct approach. I'm having difficulty with vaginal dryness and discomfort, erectile dysfunction, a very low sex drive. Can we talk about what my options might be? A practical tip, write your question down on a small piece of paper before you go. It's amazing how much courage that little piece of paper can give you. Step 3, broadening your definition of intimacy. One of the great gifts of maturity is realizing that intimacy is a vast and beautiful landscape, and sex is just one feature in it. Broaden your definition. Intimacy can also be holding hands while you watch the evening news, making time each day to truly listen to each other, giving long, sincere hugs, giving each other a simple foot rub or a back rub at the end of a long day, laughing together at a silly movie. When we take the immense pressure off of physical performance and focus instead on connection, we often find that desire follows more naturally. Step 4. The partner conversation. Building a bridge. If you're in a relationship, opening this door together can be one of the most loving and bonding things you ever do. Choose a quiet, non-stressful time. Use gentle, "I feel" statements instead of accusatory, "you do" statements. You could try something like, "Honey, I really miss our closeness. I feel like there's been a little distance between us lately, and I want to talk about it. Lately, I've been feeling a little self-conscious, and more tired than usual, a little anxious. I want you to know it has nothing to do with how much I love you." This is an invitation, not an accusation. It's a call to be on the same team. By taking these small, deliberate steps, you are taking back control of the narrative. You are saying that your quality of life in all its facets matters. As we bring our conversation to a close today, I want to leave you with 3 main ideas to reflect on. First, the human need for intimacy and connection is ageless. Those feelings are normal, healthy, and a precious part of living a full life, whether you are 65, 75, or 85. Please give yourself permission to feel them. Second, silence comes with real risks. By hiding these needs and concerns, we risk missing important medical diagnoses, putting ourselves in unsafe situations, and creating unnecessary loneliness. Sexual health is health. They are inseparable. And third, you have the power to change the conversation. Starting with one small, brave conversation, whether it's with yourself, with your doctor, or with your partner, you can begin to open the door that has been closed for too long. Like my patient Eleanor, who left my office that day with a smile of relief, not because I gave her a magic solution, but because she felt heard, validated, and no longer alone. Thank you so much for joining me for this important talk. I truly hope it has brought you some comfort and a little bit of courage. If you found this video helpful, I invite you to subscribe to our channel and maybe share it with a friend who you think might need to hear that they aren't alone either. Until next time, be well, stay curious, and please take wonderful care of yourselves. I'm Dr. Rose.